One of the most annoying diagnoses that patients have to deal with is unexplained infertility. I mean, essentially, it's just such a confusing diagnosis, and that you know something's wrong, you know something's not working, yet there's no clear answer into what it actually is, and therefore there can often be a lack of guidance in terms of what the next steps are and how to actually treat and manage this infertility. So I want to share with you one of many potential factors, and we've published a lot of videos in the past months and years talking about unexplained infertility and how often it's not just one big issue, but it can actually be the result of a variety of smaller issues that can interfere with reproductive health and reproductive capacity. So recently we've been seeing more research about iron deficiency. And iron deficiency is something that already is a well-established risk factor for miscarriage. What about infertility, particularly and unexplained infertility? So there's a recently published case control study that was published, and they found that having iron deficiency was significantly associated with the chances of having unexplained infertility. Now, one of the main issues that we have in diagnosing iron deficiency for patients is we use one of the first line tests that are often used is called ferritin. And the cutoff for ferritin when we check the blood value is 15 micrograms per liter. That's the World Health Organization's recommended range, that if it's below 15, we want to look into, does this patient have iron deficiency? The issue with this cutoff is that a lot of people have falsely elevated ferritin levels, and this can be a result for a variety of reasons, but one particular one is chronic inflammation. So there are patients that have, for example, low iron levels, but also have chronic inflammation could be a variety of reasons. Could be related to a reproductive condition like endometriosis. Polycystic ovarian syndrome is also associated with chronic low-grade inflammation. And there could be other health issues like inflammatory bowel disease, among others. So if people have chronic low-grade inflammation or inflammation in general, that ferritin value starts to go up. So we're actually seeing new studies and research suggesting that a more appropriate cutoff for that ferritin level to assess if someone's at risk of iron deficiency should be closer to somewhere around 30 micrograms per liter. So if we're seeing patients that have less than 30 micrograms per liter on their ferritin blood test, it causes suspicion in that is this individual iron deficient, and there are more specialized blood tests that can be done to help assess if the patient truly has iron deficiency or low iron levels. And there is some limited research even looking at how low iron status or iron deficiency could actually affect the maturation of eggs and follicles in the ovary as well. So we're seeing that iron specific to reproductive health may have some very important roles, and we need further larger studies and to help confirm these types of findings, but taking into account that iron deficiency is something that's actually very commonly encountered in the reproductive aged population, and taking into account the vast health benefits of having iron sufficiency and appropriate levels of iron, aside from reproductive health as well, it just makes sense that if we're seeing ferritin levels that are under 30, we should be having a conversation about potentially doing more detailed tests to actually screen for iron deficiency if we suspect that the patient might have low iron status, especially if they're dealing with unexplained infertility or they have a history of recurrent pregnancy loss. So check with your healthcare provider, but we may need more specific testing and need to think a little bit outside of the box in terms of what we traditionally think iron deficiency looks like and what it can look like for other individuals with other health conditions, such as those that contribute to chronic low-grade inflammation.